Hello everyone. Today we will talk about the early signs of diabetes. At the end of the video, you will also learn about the prevention of diabetes. So please watch the video until the end. Diabetes is a chronic disease caused by disruptions in metabolic processes in the body due to a deficit in insulin synthesis and an increase in blood sugar levels. This disease can lead to the development of serious pathologies, and at least 25% of people don't even know they have diabetes. The causes of diabetes include weakening of the immune system, genetic predisposition, disruption of metabolic processes in the body, malfunction of the adrenal glands, diseases of the pancreas, diseases of the cardiovascular system, use of corticosteroids, obesity. Early signs of diabetes. About 25% of people suffering from diabetes are unaware of the disease. Many continue to go about their business calmly, ignoring the early symptoms of diabetes, while the disease destroys their bodies. To avoid harmful consequences, early signs of the disease should not be ignored. Before moving on to the first sign, I would like to ask you to subscribe to the channel and click on the bell to be notified of new videos. Now let's move on to the first sign. Increased thirst and frequent urination. These are the most common symptoms of diabetes. In this condition, the body cannot cope with high blood sugar levels, and the kidneys cannot absorb all the excess sugar. As a result, sugar ends up in the urine and takes away fluid from other tissues of the body. The body tries to excrete excess sugar, leading to increased urination and a feeling of dehydration. Dryness in the mouth persists for a long time. Even with the consumption of large amounts of fluids, there is always a feeling of thirst, regardless of whether it is summer or winter. In an attempt to quench their thirst, the patient starts to drink even more fluids, leading to even more frequent urination. These signs may occur after eating and may be triggered by consuming carbohydrates or very sweet foods. You should not try to quench your thirst with cool drinks and juices that contain high amounts of sugar. A completely healthy person urinates an average of 6 to 10 times a day. Frequent urination and significant exceeding of this indicator can cause discomfort in everyday life. This may be a troubling sign that it's time to visit a doctor. Itchiness, as mentioned earlier, is caused by an excess of sugar excreted from the body through urine. It takes away fluid from other tissues, mainly from the skin. As a result, the skin, deprived of sufficient fluid, becomes dry, begins to peel, and itch. Scratching dry areas of the skin can lead to injury and infection. Special care is required for diabetic skin, which keeps the skin moisturized and healthy. Darkening of the skin. In addition, the skin can change its color. A black spot, acanthosis, is a condition in which dark spots with a velvety texture appear on the skin. High blood sugar levels damage blood vessels, damaging them. Dark spots most often appear in skin folds. Special attention should be paid to the nail area, armpits, groin, back of the knees, neck, and knuckles. Unexpected darkening of the skin in these areas is an early sign of diabetes and prediabetes. Increased hunger. Constant hunger is the fourth most common symptom of diabetes. If the body does not produce insulin, produces it in insufficient quantities, or does not respond to it properly, it cannot process food into glucose, from which it takes energy. Subsequently, increased hunger persists even after eating and only contributes to an increase in blood sugar levels, worsening the overall situation. In the presence of a constant desire to snack, it is advisable to consult a doctor. Chronic fatigue, loss of physical strength, exhaustion, and weakness. This is another common symptom indicating the presence of diabetes. A person constantly feels tired and weak because the cells of the body do not receive enough glucose, which can be used as energy. The body loses its vitality due to a disruption in insulin production, resulting in a lack of essential nutrients in sufficient quantities. They are poorly absorbed, which can lead to weight loss, insomnia, and decreased performance. In addition, dehydration against the background of frequent urination also contributes to fatigue. It causes the need to wake up in the middle of the night to go to the bathroom. As a result, the body does not have time to recover, and a person cannot enjoy a healthy and healing sleep. This leads to overall depletion of energy levels in the body and triggers a state of irritability. Numbness in the hands and feet is another common symptom of diabetes. High blood sugar levels lead to impaired circulation, which can damage the nerves in the hands and feet. Limbs located farther from the heart are primarily affected, which can lead to decreased sensitivity. Lack of pain sensations is also a major problem for people with diabetes, as it can lead to the development of diabetic foot. This condition is accompanied by worsened blood supply, causing tissues to lack oxygen in sufficient quantities and regenerative processes to slow down. If problems with hands and feet are ignored, the damage progresses, often becoming a cause of impaired mobility. Uncontrollable mood swings and outbursts of anger can also be caused by an imbalanced blood sugar level. People in the early stages of the disease or those who are unaware of its presence may suffer from constant mood swings, inexplicable fits of rage or depressive states. Vision problems should also be noted. If blurred vision is not associated with pathologies of the main organ, it may be an early sign of diabetes. Vision becomes blurry due to the shifting of fluid in the eyeball, causing the lens to swell and change shape. Vision becomes blurry and unfocused, making it difficult to focus on objects. Double vision may also occur or a sensation of haze and grittiness in the eyes. In most cases, these changes are reversible, and vision returns to normal, once timely treatment normalizes blood sugar levels. If diabetes is not treated in time, changes can progress and lead to complete vision loss. Sudden weight loss is another early sign of diabetes. Unexplained weight loss not related to exercise and diets is a common symptom of type 1 diabetes, but in some cases, it also occurs with type 2. Diabetes can easily take away from 4 to 10 kilograms in a few months. Weight loss in diabetes is due to the body's inability to use glucose as an energy source, leading to the burning of fat and muscle tissues instead. The body does not receive enough insulin to break down food and absorb valuable nutrients and calories. The kidneys may also suffer. To remove excess sugar from the body, they have to work much harder. Weight loss can contribute to dehydration. In diabetes, the body uses all available fluid in an attempt to produce urine. Slow wound healing in the presence of high blood sugar exacerbates inflammatory processes in cuts and wounds. Blood circulation is impaired, resulting in poor blood flow to damaged areas of the skin, prolonging their recovery. If there is itching, care should be taken, as wounds resulting from scratching can take a long time to heal, and infection can enter them. If cuts and wounds take longer to heal than before, it is important to inform the doctor. When developing diabetes, a person may suffer from spasmodic pain in the lower limbs. Often they occur in the evening and at night when the legs have been immobile for a long time. Frequent nocturnal cramps deprive the patient of rest, stealing away restful sleep. Lack of sleep leads to exhaustion of the body and the development of other diseases. The symptoms of spasms in diabetes manifest as follows: tingling sensation on the skin, burning sensation in the shin area, discomfort, and painful sensations in the legs. Hair loss can also be associated with diabetes. Emotional reactions to lifestyle changes, dietary restrictions, and concern for one's health can contribute to hair loss. With an elevated blood sugar level, there is a decrease in the body's immune response, leading to the active proliferation of microorganisms and fungi on the scalp. This can slow down the growth and thinning of the hair, as well as cause its loss. Diabetes prevention includes recommendations to maintain a normal weight, engage in physical activity, consume less sugar and saturated fats, avoid smoking, and abstain from alcoholic beverages. That concludes the video. On the channel, you can find many interesting videos about the benefits and harms of vegetables and fruits, as well as about diseases and their treatment methods. So please don't forget to subscribe to the channel and click on the bell icon. I would be grateful if you could like and share the video with your family and friends. Until we meet again.